Hello everyone, my name is Cian Miranda, and today I want to go over with you the danger of self-medication and the global impact on health. For my demonstration speech, I will be demonstrating the negative consequences of self-medication, self-treatment, and self-diagnosis, not only for individuals but also for the broader society. The purpose of this demonstration is to primarily inform and raise awareness about the potential harm that can arise from taking medical matters into your own hands. Now let's go over my credibility. So my credibility related to this topic is that I am an LVN and I've been a licensed vocational nurse since 2015. I have worked in the different areas of the medical field. First started my journey in a skilled nursing home where I was working as a night shift nurse. I've also worked my way up gaining more knowledge and experience as an LVN. I was a treatment nurse for about 2 years, and then right after that, I became a medical record director. I did that for a year, and then I was promoted to the director of staff development position, and I've been in that position for about 5 years. Now, as an LVN, I've encountered some real life experience, and I've seen firsthand the consequences of self medication and treatment. Alright, so in this slide, I will be showing you guys two different pie graphs, one on your left which shows the recommended treatment, and one on your right showing the seeking medical attention pie graph. Now, according to the survey conducted by the University of Chicago and the West Health Institute, about 40% of Americans avoid recommended treatments or tests due to the cost concerns, and about 44% avoid seeking medical attention when ill or injured, pretty much for the same reason. Alright, so on this next slides, I wanted to show you guys a graph down below from the CDC National Health Interview Survey of 2012 showing the percentage of families with selected financial burdens of medical care in the United States. So let's go ahead and take a closer look. Down at the first graph, about 16.5% of individuals have problems paying their medical bills in the past 12 months, and about 8.9% of those currently have medical bills that they aren't able to pay at all. Now, on the middle graph, about 21.4% of individuals currently have medical bills that they are being paid over time or past due. Okay, so on the last graph shows about 26.8% of individuals having any financial burden of medical care. Okay, so prior to us moving on to the next slide, I want us to have a better understanding of the three main topics that we will be going over today. First is self-medication, second is self-treatment, and third is self-diagnosis. So let's go ahead and define each and every single one of those three topics. So what is self-medication? Self-medication is mainly taking drugs or remedies without having a doctor's prescription. Now, what is self-treatment? Self-treatment mainly involves treating oneself without medical guidance. Okay? And lastly, what is self-diagnosis? Self-diagnosis mainly occurs when an individual diagnoses themselves without having to consult a medical professional. Okay. Now, why someone might ask whether is it a danger or is it safe to self-administer medication, self-treat your own selves, or self-diagnose oneself. Now, let's go ahead and go over that. So, self-medication, specifically antibiotics, can lead to antibiotic resistance. Self-treatment as well may result in improper care and exacerbation of symptoms, and self-diagnosis can lead to under or overdiagnosis, inaccurate information, and unnecessary stress. In here, I wanted to show you guys a video showing the misuse of antibiotics and other medications. So let's go ahead and watch the video together.
Good morning, everybody. Today we are going to talk about the self-medication. What are the disadvantages of using self-medication? Good morning, everybody. Today we are going to talk about the self-medication. What are the disadvantages of using self-medication? People usually start taking antibiotics. I'm Dr. M.S. Chaudhary, Senior Consultant at Indraprastha Apollo Hospital, New Delhi. People usually start taking antibiotics, which is very, very harmful because nowadays we are getting resistant to this all antibiotics. And once the patient gets sick, we are not able to give a proper antibiotics and they get a resistance and not treated properly. Another drugs all these patients are using are the analgesics, which is also very harmful because nowadays we are getting so many patients using this analgesic come to us with a kidney failure. And in this stage, they are using this analgesics. The kidney failure is the most problematic condition. Apart from this, they develop ulcers and other things. There are another drugs these used so rampantly by the patients are antihistaminic drugs, and they use all these drugs self-medicated, which is very, very harmful. So my advice to everybody that one don't use these drugs self-medication and use these drugs only by the consultation of the doctors or see the doctors. Otherwise, they are going to.
Alright, so after watching this video, we can pretty much conclude that taking antibiotics without a doctor's prescription or any type of or using any type of leftover medication can pretty much contribute to antibiotic resistance, and this can have a serious public health implications as antibiotic resistance infections are on the rise. Okay, so I will be needing you guys' participation on this next topic. All right. So I want you guys to put yourself into two different scenarios. All right. So scenario one, I want you guys to place yourself in a situation where you have access to all your medical needs. And scenario two, I want you guys to place yourself in a situation where you have limited or no access to any of your medical needs. Okay, so I want to give you guys a few minutes to think about that. And while you guys are doing so, I wanted to use myself as an example in these two different scenarios. So let's go ahead and go over scenario one. Now let's just say if I decide to self-treat myself and I might have a migraine, um, I might choose to drive myself down to the nearest store to buy myself some over-the-counter medications such as Advil, Tylenol, or ibuprofen to self-administer and help relieve my symptoms or treat my symptoms. Or what if I have abdominal pain? I can pretty much do the same thing. Buy myself some medication such as Pepcids, Pepto-Bismol, or Tums to help alleviate or relieve my symptoms. Okay? Now you see that easy access when it comes to being able to get yourself some medication that will help relieve your symptoms. Okay, so that's for scenario one. Now it's slightly different, or maybe it's much harder for scenario two, having to have those type of access when it comes to our medical needs. Okay, so now if I happen to be living in a foreign country where I may have financial difficulties, as an example, for migraine, the only things that I might be able to afford or can have an access to are the things that is either in or around my environment. Okay, so I might have a small house, and in the back of my house, I have a garden. Okay, and in my garden, I might have some herbs that I might be able to use to help with my symptoms. Okay, so for example, migraines. What can I find in my garden that might help relieve my migraine? Okay, so there's things such as rosemary, ginger, or mint that can help alleviate migraine. Okay, now what about for abdominal pain? There are some other herbs as well that we can use to help alleviate those symptoms, such as peppermint leaves, ginger again, fennel, and some other herbal plants might be used as well as an alternatives. Okay? Now, however, this treatment may mask underlying issues or cause adverse effect like constipations. All right? So on this next topic, which is self-diagnosis, I will be using the browser. In this occasion or in this situation, I will be using Google. Okay. All right. So now that we have Google open, let's go ahead and go over self-diagnosis. All right. So let's say I'm experiencing abdominal pain. On the search bar, let's go ahead and type in abdominal pain, and let's go ahead and hit or click on the search button. As you can see, there are several various possible causes related to abdominal pain. In here, abdominal pain can be somewhat related to a stomach virus, ovulation pain, appendicitis, gastritis, and or constipation. Okay, so since there are several related health conditions, there is a high chance that I may misinterpret the symptoms or choose the wrong condition, leading to unnecessary worry. Now, let's go ahead and go over the differences between a medical professional and a traditional healer. All right, so a healthcare professional usually spends a lot of their time and effort mainly acquiring their professional credentials with at least a minimum of about 8 years of education and or training versus someone who's known as a traditional healer who may have no prior medical knowledge or experience. Now, the practice of self-medication is not usually limited here in the United States. As in many cultures, traditional remedies and herbal medicines may have been used for generations to address common ailments as well. In certain regions of India, individuals often rely on traditional healers known as the village doctors, and they primarily practice alternative forms of medicines based on their cultural beliefs and their traditional knowledge rather than some scientific evidence. In here is a video showing some common practice in some communities in India, which is called the Ayurvedic medicine. So let's go ahead and watch the video together. So as you guys can see in the video, Ayurvedic medicine usually has been used for thousands of years in India. The treatment is primarily based on plants, animal extracts, and some minerals in both single ingredient drugs and compound formulation. Um, in this video, usually you guys saw that the healer performed the treatment without any proper sanitation or any medical training, potentially causing more harms than good. So instead of seeking professional medical care, individuals may turn to alternative treatments out of financial constraints or their cultural beliefs. However, these practices can sometimes delay proper diagnosis and treatment. In conclusion, self medication, self treatment, and self diagnosis can be dangerous due to the misinformation, improper care, and the antibiotic resistance. It is very crucial to consult our healthcare professionals for accurate diagnosis and treatment. Again, our health and well-being are too important to risk. Um, so that pretty much conclude my presentation. Thank you all for listening to my demonstration. And again, let's prioritize our health and make informed decisions together. Thank you.